Hey guys, welcome to GrowMed. Hello, Fmge aspirants. It's been a very long time I've been posted any videos. So as the exam is near now, so I will be active on the social media platforms and help you with the exam material and what all you must do and everything. Okay, so today in this video we'll discuss some important clinical cases asked in the Jan exam. तो रिसेंटली जो एग्ज़ाम हुआ था ना Jan 25 में, in that the clinical cases asked, we will break it into the terms and discuss it here so that it will be easy for you to understand. Okay, and chances are there that these cases might be repeated as well as FMG में भी और नीट पीजी में भी, जो कि नीट पीजी एग्जाम अभी होने वाला है. नीट पीजी aspirants can also watch this and it will be helpful for them also. I feel. ठीक है, तो let's without wasting much time start the discussion. So the first clinical case from the anatomy, and in the case things were described like tingling sensation in the hand, then lateral 3 digits were involved, and loss of sensation of the base of thumb and on the dorsal aspect of the hand. So they are asking about the nerve injured, which nerve can be injured and which nerve injury will cause these symptoms. So see, it is very simple. If we look at the this is the hand, a rough diagram of the hand. Okay, ऐसे करती हूँ मैं, a rough diagram of the hand, and we know that the nerve supply of the hand. So if we look at the nerve supply of the hand, one second, like this, these are the digits 1 2 3, and this is the thumb, this is the little finger, and this will be the thumb. So the thumb will be involved in the radial nerve injury because this area is supplied by the radial nerve, this area is supplied by the ulnar, and this is supplied by the median nerve. So look at here, the things asked in the question are lateral 3 digits on the dorsal aspect of the hand and base of the thumb. So these things are pointing towards the injury of the radial nerve. Okay, so and radial nerve, these are the sensory supply of the radial nerve. But if you look at the motor supply, the things like wrist drop can happen, and if the injury happens around the shoulder area, like under the armpit, under this, then things like this clutch palsy, Saturday clutch palsy can happen. So these are two other important things which you must remember. Then next question, face is involved. This is also a question from the anatomy, and in this also they are asking about the nerve injury. So note it down that nerve injury is a very important topic. Like you need to know all the nerve injuries, including this cranial nerves. Sometimes cranial nerve affect and they also cause some various diseases. So that is important. Along with that, these radial nerve, then the nerves of the lower limb, like the gluteal nerve injury, then the saphenous nerve injury, all these things. Okay, like slowly we will come to all those points in the subsequent videos. Now the next question is lower half of the right face with the drooping of the angle. See here, location is very important. Right half of the face is involved and drooping of the angle of the mouth is seen, and the child, I don't know, okay, it is not about a child. Now not able to raise eyebrow and close eyes on the both sides. Close eyes on the both sides. So how do you break these terms is that, see, first of all, lower half, this is the face, so lower half of the face is involved. Along with that, the upper half of the face is also involved. That means they are talking about something involved with the face. तो face में कौन सा nerve supply करता है? Usually the cranial nerve 7. तो there is a palsy of the cranial nerve 7. इतना हमको पता लग गया है. Now which kind of cranial nerve palsy it is, we will see. Usually the cranial nerve 7 palsy is called as the Bell's palsy. Okay, so the diagnosis of this one is the Bell's palsy. Now they are asking that lesion, where is the lesion due to which this is occurring. So see, lower motor neuron is involved because both upper half of the face and the lower half of the face are involved, okay, in this. And if it is an upper motor neuron lesion, only the lower half of the face will be involved. So as both are involved, then it will be the lower motor neuron. Now we should look at the location where it is. As the right side of the face is involved, so the lower motor neuron lesion is ipsilateral, so that's why it is on the right side. Right side lower motor neuron is involved, okay. So this was given in the options and this was the answer. See, if they have given like what is the diagnosis, then you should go with the Bell's palsy, or they can ask which cranial nerve is involved, then cranial nerve 7 will be the answer. So it depends on the options given as well. Then moving on to the next question, that is the third question. So this is a simple question asked in pathology. A 45-year-old female was diagnosed with brain tumor, and on a histopathological examination there was pneumoma bodies. So we know that a mnemonic for the pneumoma bodies, right? PSM. So it is in the papillary carcinoma, then meningioma and सेमाइनोमा. तो PSM मतलब सॉरी ये options में it was meningioma, because meningioma is a brain tumor. Rest all are other related to the other organs, right? So the diagnosis was asked and that one is the meningioma. ठीक है. Then moving on to the next question, this one, see, it was asked like an ulcerative lesion. So see, the question was asked on the ulcers, which is a very important topic. Then ulcerative lesion at the medial canthus of the eye, ठीक है. तो आई में मीडियल कैंथस के पास में it had pearly margin. So this is the catchword in the question, and it had palisading arrangement of the cells. So this is the main catchword for this one. So ulcerative lesion means something related to the skin tumors and the skin cancers, and the pearly margin is mostly associated with this basal cell carcinoma. So whenever this description is given, go with the basal cell carcinoma. And sometimes questions are also asked on this, like image based questions on the basal cell carcinoma and the type of ulcer. So have a look at that also. And then the next question, pneumonia with fever and cough, there was lung consolidation and culture shows green color and fluorescent positive. So the catchwords in this question is this culture, green color, because pneumonia is a very common disease, can be caused by various organisms. तो fever भी होता है, उसके साथ cough भी होता है, and lung consolidation is not a specific thing. So the specific thing is this culture, which is green color, and it is a fluorescent positive. So which organism can be the causative organism? So if it is associated with this green color, na, so usually it is the Pseudomonas aeruginosa. So this was given in the options and this was the correct answer, Pseudomonas aeruginosa. ठीक है, so remember these two words. Then the next question, there's a patient HIV positive with multiple punctured wound bites caused by a dog. So management technique, what you will manage it? See, as he is a HIV patient, he will be immunocompromised, so we need to give the vaccination to the patient. तो vaccine is the first thing we will be doing, ठीक है, rabies vaccine. Then उसके बाद we will be also giving the immunoglobulins to the patient and also wound management, like clean it with the fresh water, wash it, and then जो भी conservative treatment लगेगा wound के लिए, that one, okay. So this is the management. Then the next question, a child with one eye ptosis, look at the catchwords. वन आई टोसिस मतलब कि जो वो है eyelid है, that eyelid is closed, like it is closing the eye. Then eyelids on the affected side close while breastfeeding and open on yawning. See, मतलब कि the eyelid has some connection with the mouth, ठीक है, तो माउथ के मसल्स के साथ में कुछ तो कनेक्शन है. तो दिस कंडीशन फेमसली कॉल्ड एज द Marcus Gunn pupil नहीं, Marcus Gunn jaw winking, because these there are some fibers which are nerve fibers which are misoriented, and these fibers control the ptosis as well as the muscles of the mastication. So that's why these both क्या बोलते हैं फंक्शन जो है एक साथ में होने लगता है, ठीक है. सो दिस इज व्हाट दिस मार्कस गन jaw wing is. Then moving on to the next question asked from the ENT, and the question was something like a person with a CSOM, and this person had seizures and headache, vomiting and photophobia. So these were the complaints of the patient, and image based question. This image was given and they had asked for the diagnosis. So see here in the image you can clearly see that there is a mass present here in the temporal region, the temporal lobe. So from the given options the correct answer was this temporal abscess. So due to the temporal abscess, this a person was having these things, because CSOM, because of this otitis media, the infection from the ear travels to the brain very easily and will affect the brain. So that's why this is the mechanism by or causing causative क्या बोलते हैं reason for this temporal abscess. Okay, so that's all in this video. We have discussed some important things as well as the important diseases which are asked in the question frequently. So I hope this video was useful to you. For more such videos, subscribe to Growment, and for the PDF join my Telegram channel, and for the more flashcards, reads about the important topics and all, you can follow me on the Instagram. The link will be given in the description box. Once again, thank you so much guys for watching this video, and all the best for the upcoming exam.